Hi everybody. Okay, so I'm not sure if you guys get a chance to look at my video on fibromyalgia, which is one invisible illness that I am battling. But I am also seeing a hematologist, a blood doctor, because I have some issues with my blood work. I'm severely anemic, and they want to know if it is due to me having an underlying autoimmune disease. So recently my blood work has tested positive for inflammation in my body. They're not sure where it's coming from. And it also tested positive for IBD and bowel disease. So we're not sure what's going on, if I have UC, ulcerative colitis, or if I have Crohn's disease. Those are two diseases under the umbrella of IBD, irritable bowel disease. Irritable bowel disease is different from irritable bowel syndrome. It's more severe. It's an autoimmune disease. And there's no cure for autoimmune diseases, so I do suffer with a lot of stomach cramps, stomach aches, diarrhea, and sometimes it depends. I notice when I have milk or I eat nuts, I'm in agony for the next few days. Trips to the bathroom, stomach cramps that you basically feel like you're dying. So just because I tested positive for this through my blood work doesn't mean that it has been confirmed. So I'm going to a gastro doctor actually today, and hopefully I'll get some answers for that part of my blood work. The other part, like I said, is I'm severely anemic, and I'm actually getting iron infusions for that. I got one last week. I wanted to film it, but I couldn't because there were other patients that were also getting infusions. Some were chemo patients and some were getting iron infusions, but I didn't want to invade anyone's privacy, so I did not film that. I have my second iron infusion this week, so hopefully that will take care of the anemia if I don't have an autoimmune disease, because I guess sometimes people who suffer from autoimmune disease have anemia. So my rheumatologist is the one who referred me to the hematologist because he was concerned about my blood. He's trying to figure out, because I go to him for fibromyalgia, but he's trying to figure out if the autoimmune disease that I may have is lupus, RA, or if it is stomach related. So once I meet with the gastro and he makes his findings, then the rheumatologist will be able to better know what's going on with me. So, besides the fibromyalgia, I most likely have a autoimmune disease. We don't know if it's stomach related or if the inflammation is coming from somewhere else. So not too happy about this, but I have to go to the doc to find out what's going on with me. When you're severely anemic, you're exhausted all the time. You can have sleep problems, some hair loss. You're just tired all the time. So wasn't looking forward to the infusion, but I'm hoping it'll make me feel better. So far, no improvement. I got the infusion, I think, last Thursday, and I still no improvement. I don't know if that's because of the anemia or because of the fibro, because that makes you very, fatigued. So yeah, today after I go to the gastro, we'll see what he says, and then I am getting injections 2 days from now in my back, sacroiliac injections, because I am having severe lumbar pain in my lower spine, and it is radiating down to my legs, my thighs, and the back of my legs, my calves, because I do have herniated discs, and the last vertebrae is pressing on my sciatica nerve. So they're hoping that with these injections I'll find some relief. If not, we have to find other options. I know he spoke to me about a nerve stimulator, like implanting it for a 7-day trial, and if it works, implanting it permanently. So that's, second. And then I was also reading online about a lumbar laminectomy. That's a big surgery, but they kind of shave off some of the bone that's pressing on the nerve, and hopefully that would provide some relief. So there's a lot of things going on besides the fibromyalgia, the herniated disc, sciatica, the injections, the anemia, the possible autoimmune disease, and not to mention the arachnoid cyst. But, I'll speak about my arachnoid cyst in another video. So I just wanted to speak to you guys about, me being tested for autoimmune diseases, possible lupus, RA, or IBD, and about, my injections for my lower back. So stay tuned.